Good evening, everyone. I'm Beryl. I'm doing my first year bond in Chittoor. My topic is deliberate self-harm and poisoning patterns and outcome from a secondary care center. The DSH per se has been increasing throughout the years, and according to 2019 census, the Tamil Nadu about 9.1 percentage, or it accounts to 9.1% of disability adjusted life years. This study was mainly carried out to know the patterns and outcomes in the local area in Chittoor. So the aim of the study was to know the pattern and outcome for the of DSH among in secondary care center, and the methodology used was it is a retrospective observational study in patients who presented to ED with deliberate self-harm for 5 years. So the results, out of 179 patients, there were 59% were female, and you can see this graph. There has been increasing in number of patients from 2019 to 2024. Every year, the load of patients with deliberate self-harm presenting to ED has been increasing, and the other graph in the age-wise distribution. So it depicts about 58% of age group is between 20 to 40 years of age. That is the reproductive age group. And the most commonly used poison, or the most common used mode, was agrochemical ingestion. So that accounts to 29 number in among reproductive age group. And among agrochemicals, the most commonly taken poison was amitraz, and secondary to OP poisoning. On further analysis, we also found that about only 10% of patients who had a deliberate self-harm had an underlying psychiatric illness, and most of it was due to any like a immediate response to any grief. And about 64% of patients were referred for higher center for management, and 64% of patients were had lost to follow up. And among the patients who have lost to follow up, about 3.4% came with a repeated attempt, and the overall mortality in emergency department was 1.5 years, and we couldn't follow up on the patients who were referred from the center. On conclusion, so deliberate self-harm has been increasing drastically over the years, and still agrochemicals have been the most common mode of ingestion, and pattern recognition and early management can improve morbidity and mortality.
I think they were nicely presented, and the objectives have been clearly laid out. Only thing that one issue, that when you see the number of people increasing in a hospital setting, it does not necessarily mean that there is due to an increased incidence in the community. It can be due to different other, for example, your hospital becomes, the bed strength in the hospital ICU is increasing. That per se will increase the thing. So the spread of the disease and the type of disease, etc., well, the conclusions are valid. But that it really increases the incidence, you should not say, because that's not a valid.
Dr. Beryl, your study is very well done. You got all the data. Your conclusion is also correct. But if you want to be really, what is your next step? Conclusion of your study is fine. Sir, so many people died of hanging. So many people had agrochemicals. Now, your role based on this study is what next? How are you going to take it forward? Prevent death? Stop agriculture? treat the source of depression or etc. You should conclude with that. Okay. The meaning of my study is it now gives me an opportunity to do what X, Y, Z. Okay. Otherwise, you're not benefiting in the society as such. Very good.
Thank you, sir.